Gonal should be stored inside a fridge. It comes in either 900 or 300 units. The packaging contains one pre-filled pen and many disposable small needles. You should be injecting daily the units instructed by your coordinator. For example, if you are instructed to perform 300 units daily, one pen of 900 units should last you for 3 days. You will notice the number 0 appears in the dosage display. Turn the dose setting knob until your prescribed dose appears in the dosage display. If, for example, your dose is 300 units, that is the number that should be appearing on the display. After you set the dose, remove the pen cap. Remove the peel-off seal from the outer needle cap. Attach the needle by pressing the threaded tip of the pen into the outer needle cap. Screw it until it is firmly locked in place. Remove the outer needle cap and you will notice that there's a small second needle cap. Remove the second one to reveal the needle. The injection should be performed during nighttime. Please select the time between 8 to midnight to perform the injection. This small needle is designed to deposit the medication subcutaneously. Thus, you will need to insert the whole needle into the skin. Gonal injections are subcutaneous injections that should be performed in the lower abdomen. Use 3 fingers placed under the belly button to find the location of the injection. Please note that it is important to rotate injection sites. After you select the injection spot, take some gauze soaked in alcohol, rubbing alcohol swabs, and thoroughly clean the injection site. With one hand, pinch your folds of skin and insert a needle at a 90 or 45 degrees angle. Push the dose setting knob as far as it will go steadily without stopping. Take the needle out of the skin and with your cotton pad or swab, massage the area for 3 seconds to disperse the medication evenly. Then carefully put the outer needle cap back on and unscrew the needle. Dispose the needles in a suitable container or bring them to the nearest medical facility where they can dispose them for you. If you have any further questions, please feel free to contact our IVF unit.